This was an 83-year-old woman that had come in as an outpatient. Her doctor had ordered a renal ultrasound on both the kidneys and the bladder. She has a history of chronic kidney disease and a history of breast cancer. The patient stated that she currently wasn't in any pain. She was a sweet little old lady just coming in for her scan. So I started with the right kidney. The echogenicity was fairly similar to the liver. It was a little bit increased. I measured the kidney, and it was measuring about 10 centimeters, so it's fairly normal. So I scanned through the right kidney. Everything looked good. I didn't see any cysts or anything that looked abnormal. So I went on to the left kidney, and I did the left kidney spleen picture, and you can kind of see this spot in the spleen and up there. And I was like, well, I got to make sure I go back and look at that, because that doesn't look normal. But I continued with the left kidney. To me, the left kidney looked very heterogeneous. There were spots. This is where I measured it, and it was measuring 10 centimeters too. So I'm assuming she was like in the early stages of chronic kidney disease before they really started to shrink. So she had one cyst that was measuring 1.6 centimeters in the lower pole of the left kidney, and then she had another one in the upper pole that was 0.82 centimeters. So they're fairly small. I did image the bladder, and I got both of the jets. And so then I went on to the spleen. I started off, and I didn't take many pictures of the spleen. I just showed it, but because I wasn't sure if I was allowed to take that many. So I went and told the sonographer that, hey, like, her spleen does not look normal. She has masses all throughout. So she came back through and took even more pictures. And you can see she has a huge one, and then she has like some smaller ones, and they have flow. You can see there's flowing around, kind of more around that one, not so much through it, but she did measure them. So in the notes, we put the kidney measurements, that they were still measuring within normal limits. The two cystic areas that were in the left kidney, and then she noted that of the masses that were incidentally seen throughout the spleen. And the spleen she measured was, it was actually measuring large. It was measuring 17 centimeters. And the largest mass in the spleen was measuring 6.8 centimeters. So there's our sheet. This is the RAD report. And his impression was that there was mild increased echogenicity in both kidneys, which can be seen with the renal disease. There was no evidence of hydro, and there was a small left renal cyst. He noted the incidentally seen heterogeneous masses within the spleen, and he suggested that it could be better evaluated with the CT. So I don't have the images for the CT, but I do have the report. So here's the report, and his impression, or hers, was that there was new spleen. So she had a CT back in 2006 that he found it was normal. There was new splenomegaly since then, and the intrasplenic mass lesions were compared with this previous study. He said that, I don't know, I keep saying he, they suggested that it could be splenic lymphoma or an infection etiology. They stated that the metastatic disease may not be it, because they said that it's unusual for it to start in the spleen. And they didn't see it anywhere else, so they said it most likely was on rats. So I thought this case was interesting because she was a really sweet little old lady that you just feel bad for after the exam. And she was just going about her day. And so I was doing the kidney exam, and it's just kind of cool that you just accidentally find something. It's like, what if you wouldn't have accidentally found that? So I kind of knew about the chronic kidney disease, and I was kind of expecting to find smaller kidneys, but I guess she's in the earlier stages. And then the interesting part for this case was the spleen masses. I thought originally that it was Mets, because of her history with breast cancer, and I thought, well, maybe looking at them, they could be meds with her history and everything. But then, if you kind of look, they don't really have the halo appearance that I think. They're more just heterogeneous looking. And the radiologist stated that too, so it kind of really just, nope, not meds. So I went back and looked up splenic lymphoma and the sonographic findings of that. And sonographically, they appear diffuse, hypoechoic, and inhomogeneous. They can also create a nodular spleen throughout. So I think that matches the sonographic findings really well. So I agree with him. It also is typically seen in older patients. He also suggested it could be an infectious etiology, which means that it could come from any infection or disease. So that was kind of interesting to say, realize that it could cause something like that serious looking. And then she also has splenomegaly, which the normal limit for a spleen is 12 centimeters in length, and hers was measuring 17 centimeters. So she was sent for an oncologist, or sent to an oncologist, but I don't have the results for that. So I'd be interested to see